From this point forward, we'll shift our focus to the mandibular molars. First, let's look at the prep for tooth number 46 in the parallel alignment mode. We'll review the tooth number 46 occlusal prep, utilizing the grasping suction mode with parallel alignment. In order for drainage and suction to occur effectively to the right, the patient's head should be facing directly forward, but with a slight rotation to the right. The operator's neck stays in a normal range, as tooth number 46's occlusal surface is visible, so no additional flexion or rotation is needed. The suction tip is given an inward bending and then grasped and held firmly in the left hand. Using the suction tip, delicately nudge the upper right side of the tongue, simultaneously performing retraction, suction, and ensuring the tongue's protection. The left hand's fourth and fifth fingers rest on the left masseter, while the right hand's equivalent fingers rest on the right masseter. The handpiece approaches and enters the oral orifice surface in a perpendicular orientation. Now, in suction's grasping mode, we'll examine tooth number 46's buccal surface prep. For visibility of the buccal surface, the patient's head should face forward, but with a slight rotation to the left. The operator's neck stays normal, as number 46 occlusal surface visibility is good, so no extra flexion or rotation is necessary. The suction is given an inward bending and held in the left hand. Place the suction tip deep within the right vestibule to effectively achieve the dual functions of obtrugate retraction and the concurrent aspiration of salivary secretions. The left hand's fourth and fifth fingers rest on the mentum, while the right hands correspond on the right masseter. The handpiece enters at a slight angle, not completely perpendicular to the plane of the oral orifice. Now, using the grasping mode for suction, let's examine the prep of the buccal and the mesial distal surface from the buccal aspect of tooth number 46. To get a clear view of the bucco-mesial and bucco-distal surfaces, the patient's head is rotated to the left. For better visibility, the operator's neck should have forward flexion and lateral flexion to the right. The suction tip is given an inward bending and held in the left hand. Position the suction tip in the right vestibule to achieve both retraction and suction at the same time. When water gradually accumulates in the left retromolar pad area, periodically reposition the suction tip to that specific region and perform an intermittent brief suction. The fourth and fifth fingers of the left hand rest on the mentum, and the fourth and fifth fingers of the right hand rest on the right masseter. The handpiece inserts at a slight angle, not perpendicular to the oral orifice. This is somewhat a less common insight. Whether utilizing suction or a mirror, if you continuously retract with your left hand for an extended period, even if the required force is minimal, it can destabilize your musculoskeletal system and lead to undue strain. Therefore, it is much better to grip and brace the suction tube or mirror with the minimum amount of force possible, as long as it still fulfills the intended purposes of retraction, suction, maintaining the operative field, and ensuring clear visibility. Now, using grasping suction, we'll examine tooth number 46's lingual surface prep. For better visibility of the lingual surface, the patient's head is rotated to the right. If there isn't sufficient right rotation of the patient's head, the operator's neck would then need to undergo left lateral flexion. With this principle in mind, you can appreciate that a more active tilting and rotation of the patient's head will lead to a progressively more comfortable posture for the operator. Returning to posture, the operator's neck should have forward flexion for better visibility. The suction tip is given an inward bend and firmly grasped in the left hand. Position the suction tip to the left of the handpiece's burr and simultaneously on the upper right side of the tongue to provide both retraction and effective suction. The left hand's fourth and fifth fingers rest on the left masseter, while the right hands do so on the mandibular molars. The handpiece enters perpendicularly to the oral orifice plane. Now, using the grasping mode for suction, we'll examine the mesial and distal prep on the lingual aspect of tooth number 46. For visibility, the patient's head is rotated further to the right than before. The operator's neck should have forward flexion and left lateral flexion to ensure good visibility. If you wish to obtain improved visibility of the mesial and distal adjacent surfaces without causing undue strain on your body, then shifting to the perpendicular alignment mode presents itself as a viable option. Give the suction an inward bending and hold it in your left hand. Position the suction tip to the left of the handpiece burr and on the upper right side of the tongue to achieve retraction, suction, and protection all at once. The fourth and fifth fingers of the left hand rest on the left masseter, and the fourth and fifth fingers of the right hand rest on the mandibular molars. The handpiece will enter perpendicularly to the orifice plane. Now, with the suction and hooking mode, let's look at the prep of the occlusal surface of tooth number 46. For optimal drainage and suction towards the left, the patient's head should be oriented facing directly forward, yet simultaneously incorporating a gentle rotation towards the left. Since you get good visibility of tooth number 46's occlusal surface in a normal range, no extra flexion or rotation of the operator's neck is needed. To ensure visibility of the occlusal surface, it's essential to have the chair in a semi-supine position and set the headrest so the patient's head is slightly tilted down. If that setup isn't in place, your line of sight to the occlusal surface won't be nearly perpendicular, becoming closer to parallel instead, which hinders visibility. Give the suction an inward bending, then hook it to the left. With your now free left hand, strategically place a mirror between tooth number 46 and the tongue, thereby simultaneously ensuring vital protection and efficient retraction. The left hand's fourth and fifth fingers rest on the left masseter, while the right hands do so on the right. The handpiece enters perpendicularly to the oral orifice plane. Next, with the suction hooked, we'll examine the prep of tooth number 46's buccal surface. To get a clear view of the buccal surface, the patient's head should face forward but be slightly rotated to the left. This slight left rotation allows water and saliva to naturally pool in the left retromolar pad area, which is also helpful for suction in hooking mode. The operator's neck allows clear buccal view of tooth number 46 within normal range, requiring no flexion or rotation. At this point, if you need additional visibility of the adjacent surfaces of tooth number 46, you can turn the patient's head further to the left and apply right lateral flexion to your own head. Apply an inward bending to the suction and hook it at the left corner of the mouth. Place the head of the mirror held in your left hand in the vestibule to get additional protection and retraction. Left hand's fourth and fifth fingers on the mentum, right hand same fingers on the right masseter. The handpiece doesn't enter perpendicularly to the oral orifice, but at a slight angle. This is because its virtual axis means that the virtual axis of the handpiece enters more perpendicularly, nearly perpendicular to the buccal surface of tooth number 46. Now, let's observe the prep of tooth number 46's lingual surface with the suction hooked. To get a clear view of the lingual surface, the patient's head is rotated to the right. For optimal visibility, the operator's neck should undergo forward flexion. Then, apply an inward bend to the suction and hook it on the left side. This prevents interference with right side postural elements. The mirror head is positioned to the left of the handpiece and to the right of the tongue, simultaneously providing both retraction and protection. The fourth and fifth fingers of the left hand rest on the left masseter, and the fourth and fifth fingers of the right hand rest on the mandibular molars. Thus far, we've covered tooth number 46's posture in parallel alignment. From now on, we will look at the prep for tooth number 46 in the perpendicular alignment mode. We will now prepare the occlusal surface of tooth number 46 in perpendicular alignment mode, with the suction tip held in a grasping fashion. The operator's body is at the 9 o'clock position, perpendicular to tooth number 46's axis. For visibility and suction, the patient's head is rotated to the right. Similarly, to ensure clear visibility of the occlusal surface of tooth number 46, the operator's neck will exhibit a slight forward and left lateral flexion. At this juncture, if the chair position and the patient's head tilting are not accurately set up, the operator's neck will experience unduly excessive flexion. The right hand's fourth and fifth fingers rest on the mentum. While grasping the suction with the left hand, its fourth and fifth fingers rest on the right masseter. The suction requires an outward bending. This enables a more natural left-hand posture. These elements are nearly the same as when prepping the mandibular premolars. In many cases, the postural elements for prepping premolars and molars are very similar. However, during the preparation of molars, in contrast to premolars, there is a heightened demand for more refined and meticulous visibility, ensured accessibility, adequate protective measures, and effective suctioning. In perpendicular alignment, we'll examine the prep of number 46's buccal. To ensure clear visibility of the buccal surface, the patient's head undergoes a gentle rotation towards the left side. Similarly, for visibility, the operator's head has a slight lateral flexion to the left. The right hand's fourth and fifth fingers rest on the mentum, while the left's rest on the right masseter. It's harder to get visibility of number 46 distal than number 46 mesial, and number 47 distal than number 47 mesial. Therefore, as you move posteriorly, it's better to rely more on sensory-based information from tactile feedback rather than relying too much on visual information. My technique involves primarily prepping as much of the area as feasible based on visual assessment. For sections that are beyond direct sight, I rely on tactile sensation for the prep, consistently verifying my progress through indirect views with a mirror. To draw a comparison, imagine a mouse nibbling cheese from one side, then the other, while it has a clear view. Subsequently, it concludes consuming the remaining hidden cheese portions, guided purely by its sense of touch. The photo on the right shows the posture for the perpendicular alignment mode used for a palatal prep of the maxillary anterior teeth. In this specific scenario, by lowering the headrest to its maximum extent at the back, we can elevate the patient's chin. This action, in turn, significantly alleviates the burden of right lateral flexion on the operator's neck. Similarly, when assuming the perpendicular alignment mode to prep the target area of the mandibular molars for visibility and axis alignment, the left lateral flexion of the neck is required. However, if the dental chair and headrest are appropriately configured for mandibular treatment, utilizing a semi-supine mode with the patient's chin tilted downward, the strain on the left lateral flexion will be significantly diminished. This exemplifies how basic postural principles remain consistent across maxillary and mandibular cases. Perpendicular R alignment is not suitable for the lingual prep of tooth number 46. Perpendicular L alignment or parallel alignment is more beneficial, so this lecture will not cover them. Still, it helps with visibility and access for the linguomesial line angle of tooth number 46. Next, in perpendicular L alignment, let's prep the occlusal of tooth number 46 with the suction and grasping mode. The operator is at 3 o'clock, perpendicular to tooth number 46's axis. For visibility, the patient's head is slightly rotated to the left. The operator's neck is within normal limits. The right hand's fourth and fifth fingers rest on the right zygoma, and the left hand holds the suction, with the fourth finger resting on the left masseter. The suction tip is basically placed on the lingual aspect of tooth number 46 to shield the tongue, while intermittently moving to the patient's left retromolar pad area to clear pooled saliva and water. Nevertheless, for occlusal prep, parallel and perpendicular R alignment modes are more advantageous than perpendicular alignment. I want to emphasize again that it's crucial to experiment and find the postural settings that are most suitable and advantageous for you for each target area. This concludes our detailed examination of the assist-free prep for tooth number 46. We appreciate your attentive listening